Your Excellency, the Deputy High Commissioner, Australian High Commission, members of the Diplomatic Corps, the Coordinator of World Mosquito Programme Fiji and the team from Australian High Commission, team from the Ministry of Health, Rosy, Suva and Titamago and the members of the Banwa. Who am I missing? Invited guests, media partners, ladies and gentlemen, it's a Mulaminak and a very good afternoon to you all. I was so looking forward to this evening's lunch. Unfortunately, the day I started my day traveling in the interior of Singapore, and I just arrived from there. It's taken a lot of my energy away. But believe me, mosquitoes have been occupying a lot of time. Over the last few months, all I've been doing is thinking about mosquitoes, you know. And if I'd been thinking about my children and my partner, I would have had a better sleep. But I haven't had a good sleep over the last couple of months because of mosquitoes. And I didn't know mosquitoes could be such an important part of our lives. And the fact that we have gathered here today is probably due to mosquitoes. Not in a sort of very interesting and very exciting way. And so this evening, ladies and gentlemen, we're here to officiate the launch of this very, very unique initiative of the World Mosquito Programme. And first of all, I'd like to put on record our government's appreciation to the Australian High Commission, Deputy Commissioner, you and your team, and the team from the World Mosquito Programme and the Monash University. Thank you for being with us over the year or so and helping us find a solution to this, what should I call it? A nightmare. I mean, the media has been flooded with reports about the rise in dengue cases in Fiji. And I think to date we have recorded quite a high number. Dr. Alicia, please correct me, close to about 1,854 to be precise, as of this month. And I'm sure you're aware that we have another nightmare on our hands with the outbreak of meningococcal. It's taken me a lot of time to learn these terms, but again, very interesting and very exciting. We have issues at hand, and I think together as we collaborate with our partners and our stakeholders, we try to find a solution to this problem. And today, the launch will see how best we are going to tackle dengue, chikungunya and Zika for our people here in Fiji. So ladies and gentlemen, the program is a clear indication that the Ministry of Health and Medical Services will continue to aspire to enhance its access to quality health facilities necessary for good health and to healthcare services including communicable diseases such as mosquito-borne diseases, as we mentioned, Zika, chikungunya and dengue. This aspiration is in line with the National Development Plan that the Fijian government launched in November last year at the COP23 in Bonn, Germany. The 5-year and the 20-year plan provides a forward-looking vision for transforming Fiji into an even more progressive, vibrant and inclusive society. Our dedicated and service-oriented doctors, nurses and health professionals in the hospitals, medical centers and clinics around the country continue to serve as a team with one singular goal, providing the best possible healthcare for all our people. Ladies and gentlemen, that is the commitment of the Ministry of Health and Medical Services and the government of the day. Sadly, in the past few months, our nation has faced a dengue outbreak that has rapidly spread across. The Ministry has taken drastic actions to prevent the spread of dengue through intensified approach to public awareness, cleanup campaigns and spraying activities. We continue to encourage all Fijians to help us control the spread of dengue. And we continue to tell people that we can do so by destroying the breeding places of mosquitoes in our yards, emptying containers, simple things, emptying containers filled with stagnant water, just as few measures to counter dengue. However, I still believe there's a lot of work that needs to be done. So we will continue to encourage Fijians to correctly use safe mosquito repellents. In doing so, we believe that the people will be helping us in our efforts to control and prevent dengue from rapidly spreading. We are under a lot of pressure to have mass spraying, nationwide spraying, but we have also indicated to the public the other side or the impacts of mass spraying, inducing chemicals into the environment. So that is, though spraying is a measure to destroy the breeding grounds of all mosquitoes, we are trying to educate people that spraying only kills adult mosquitoes. The whole rationale behind approaching dengue control methods at the moment is to ensure that we destroy all breeding places which exist around our environment. So ladies and gentlemen, dengue remains a public health issue for us in Fiji, and the government, I've always said, cannot fight it alone. The control and prevention of this deadly dengue virus is everyone's responsibility. We must all make a concerted effort to ensure that our communities and our nation is dengue-free. Therefore, I'm very much pleased to be here this afternoon at this unique launch of the World Mosquito Programme. The project, now globally known as World Mosquito Programme, was initially, as mentioned, known as Eliminate Dengue when endorsed by Cabinet on 20th July 2017. This led to the signing of a Memorandum of Agreement by the three parties on 6 November 2017 for the implementation of the project to commence this year, 2018. In recent years, the initiative has grown from a single focus on dengue to include other mosquito-borne diseases such as Zika and chikungunya. That's why, as of September 2017, the Eliminate Dengue program became known as World Mosquito Programme, a name that better reflects the scope of the program's delivery and reach. The World Mosquito Programme is a global, not-for-profit initiative that works to protect the communities around the world from mosquito-borne diseases, again, like dengue, and led by Monash University in Melbourne, Australia. And I'm told that the World Mosquito Programme currently operates in 11 countries, including Fiji. This innovative method that World Mosquito Programme employs is safe, natural, and effective. That method is called Wolbachia bacteria, and Wolbachia can combat life-threatening mosquito-borne diseases such as dengue. And actually, the video that we saw was quite self-explanatory. Wolbachia, ladies and gentlemen, does not involve genetic modification, as the genetic material of the mosquito has not been altered. In fact, it is completely natural and extremely common in the existing ecosystems. Long-term monitoring shows that Wolbachia is self-sustaining at high levels in the majority of World Mosquito Programme's international project sites up to 7 years after release. In these areas, there has been no evidence of local dengue transmission. Ministry of Health and Medical Services is therefore very proud to join forces with the World Mosquito Programme in reducing the risk of dengue and other mosquito-borne diseases in Fiji for our people. To that end, my ministry looks forward to working with the World Mosquito Programme, Monash University, and all other partners in the control and prevention of dengue and other mosquito-related diseases. Together, we look forward into robust strategies and enhanced approaches to eliminate dengue and tackle these communicable diseases with renewed efforts and strengthened partnerships that will get us evidence-based results both now and in the future. So ladies and gentlemen, I wish to convey my best wishes to the World Mosquito team here, to the team from the FED, Deputy Commissioner, you and your team, the team from the World Mosquito Programme, from the Monash University, and of course, my own team at the Ministry of Health and Medical Services, very ably led by Deep. I've heard some very good things about you. Congratulations. And I'm sure we are going to see, he's shy. and I'm sure we look forward to strengthened collaborations in the past. We look forward to working with the Vanua where this will be trialed, and I'm sure we will see positive results in the coming months and the coming years. With these words, ladies and gentlemen, I still would like to talk a little bit about the recent outbreak and the fact that we are now going to make it our business to ensure that every household understands the impacts of dengue, the impacts of meningococcal outbreak that is currently. Our Prime Minister today at KRC spoke to the villages about hygiene practices and the way we can combat the cases of meningococcal meningitis, right? And the fact that it's life-threatening. Okay? We want everybody to be serious about these diseases. I mean, on one hand, we have NCDs that are taking our lives. Now, on the other side, we have another burden of CDs, communicable diseases. So again, we will not be able to do it on our own. We need strengthened partnerships with all our partners, all our stakeholders, all individuals, and especially the media organizations. You are very much crucial in a fight against both CDs and NCDs, and I believe that you can assist us by taking this message down to grassroots level, to every TV room, giving this a priority, that we need to ensure that our families are safe from this. And again, and the fact that we all have a part to play in this. Simple hand washing practices, keeping our environment clean. And in case of meningitis, knowing the signs and symptoms. We will be bombarding the news stations, the media outlets with mass communications so that everybody is aware and that nobody can come back and say, I did not know the signs and symptoms. So we urge people in this room, please, if you get an opportunity to share this information in your organizations, within your colleagues, within your families, please do so, because the recent outbreak is actually more deadly than dengue. And that's what we want to say. Dengue people could have taken lightly, but meningococcal and I'm so confused with all these words. Meningitis, please don't take it lightly. It's a killer. So I think we'll be rolling out a lot of media information that will be distributed to schools and students and communities from health centers. Our teams, the task team, will also be going out and talking to people to ensure that everybody is on the same page. Right? And we really want a lot of information going out on these two communicable diseases together with our NCDs that is also there. So it's a very good platform. So I actually appeal to all our media partners present here today. Please come on board with us and help us save our fellow Fijians from this deadly outbreak that is currently in Fiji. So, ladies and gentlemen, thank you very much, and congratulations to the World Mosquito team and the Ministry of Health and DFED, Deputy Commissioner, you and your team, and everybody who is present here. That shows your commitment towards improving the lives and health of our fellow Fijians. Please do your part. Whatever you can do in a little way or in a big way, be part of this initiative, and I'm sure we will be able to make a change for our future generations in tackling dengue, Zika, and chikungunya. So with these words, thank you very much, and God bless you all.